I think generally with breast surgery, the main determinants are what the patient might want or what they think they might want and what they're willing to deal with. If they want potentially an ideal result and have like perfect breasts, they might need an implant and a breast lift, but sometimes they don't like the incisions from the breast lift. So you may tell them the only way you can basically fill the skin envelope is with a larger implant, which is fine. If they're willing to accept that. If patients, have ideal breasts, then I try and steer more towards smaller implants just because over time, women's breasts seem to get bigger, obviously, and it's a harder fix if you're going to remove an implant and now you have to do a lift. So if you can keep people, with smaller implants and get, good results that way, and with the broad technologies like they are nowadays that they didn't exist, 15 years ago, you can get good results with it. But I do try and have the patients kind of guide us as to what they would think was good. So I'll send them to an implant website and try and have them find before and after photos that they feel would look good for them. And then if we can do that, it's worth it. Because otherwise I tell them, if I don't see a photo, I have about a 1 in 3 chance of making them happy. Either they're gonna wake up and say, my doctor's great, or they're going to say, I wish I was a little bigger, or maybe I'm too big. So if they bring in the photos, we actually use those during surgery. We'll put them up on the operating room wall and then use sizers and determine what, size implant to use for them. Beyond that, with the other breast surgery, sometimes, some patients come in, if they're happy with their breast size and they're just unhappy with the shape or the look of the breast, then we'll guide them more towards a mastopexy or breast lift. And that simply moves the nipple, rearranges the skin tissue and the gland so that the breasts are, at a better position, with our markings and that, and it gives a more youthful appearance. The only disadvantage are really the incisions, but if you're careful with those, you can usually get very good results with just the mastopexy alone.